According to the Congressional Budget Office, the health care reform package will cost $938 billion over 10 years and cut the deficit in the same period by about $143 billion. And eventually, about 94% of Americans will be covered by insurance. Among the public today, opinions varied widely.
I think you got a lot of people who are just looking for free health care. I mean, who wouldn't? And I think the people who support the bill are looking for a form of welfare, frankly.
I just don't think we can afford it. I think if it was a good bill, they wouldn't have had to cut so many deals.
A lot of people don't have health insurance, can't afford it. So anything that might allow people to afford health insurance would be great.
As we mentioned earlier, more than half of Americans say they don't understand what's in the reform bill. So tonight, we begin a user's guide, and we're starting with those Americans who may have the most to gain, the uninsured. Right now, there are 46 million uninsured Americans. Under the bill, by 2019, 32 million of them will be covered. That will leave about 14 million without insurance, including undocumented immigrants and those who choose to pay a fine instead of paying for coverage. Ben Tracy has more about insuring the uninsured in Chapter 1 of our User's Guide to Healthcare Reform.
Under the bill, most Americans are now required to have health insurance. The government will help people pay for it by expanding Medicaid programs to include families making less than $29,000 per year and singles making less than $14,400 per year. To make their insurance more affordable, families making less than $88,000 a year will have their monthly premiums capped at anywhere from 2 to 9.5% of their income. Right now, there is no cap. And a significant change, young adults can now stay on their parents' coverage until age 26. In exchange for the help, those who refuse to buy health insurance will pay an annual penalty of $95 in 2014. And finally, insurance companies can no longer deny coverage to those with pre-existing conditions. For adults, that rule begins in 2014. For children, it goes into effect 6 months after the bill is signed. That's good news for 6-year-old Lucas Avant. Wow! He currently has no insurance because he had Kawasaki syndrome, a treatable heart problem when he was 9 months old.
Started up here.
How many companies have you applied to, and how many denials have you gotten?
We've applied to about 6 different insurance providers, and we've been denied by all of them.
Under the bill, Lucas and the 12.6 million other Americans struggling to get health insurance because of pre-existing conditions will now be able to get coverage. But 29-year-old Michael Mount isn't so thrilled. He's young and healthy and doesn't have health insurance because it costs too much.
Unfortunately, I look at health insurance and health benefits as more of a luxury item than a necessity.
Under the bill, he is now required to buy insurance by 2014, which could cost him nearly $200 per month. If he refuses, that $95 penalty will increase to nearly $700 by 2016. He thinks health care still needs to be more affordable, but for the 32 million uninsured Americans about to get coverage, it's a start. Ben Tracy, CBS News, Los Angeles.
Now to those who currently have insurance. 176 million of us get it through our employers. That's nearly 59% of the population. President Obama has long said, if we have it and like it, we can keep it. But Mark Strassman tells us it's still going to cost us.
For most Americans insured through work, coverage is expected to stay the same or improve. With no lifetime caps, no denial of benefits if people get sick, and continued coverage if you lose or change jobs. But premiums will continue to rise. How much? No one's certain. To pay for all this sweeping reform, here's what will change. Tax-free flexible spending accounts will be cut in half. They reimburse some medical bills not covered by insurance. The new cap, $2,500. And if you make more, you'll pay more. Starting in 2013, individuals earning more than $200,000 a year and families earning more than $250,000 will pay almost 1% more on their Medicare payroll tax. For a family earning $500,000, it means an extra $2,250 a year. Those same high earners will face an extra 3.8% Medicare tax on their net investment income.
We'll try to cut those in the morning then.
Rick Swartz buys his family's health plan through work. He's the fleet manager at D.H. Griffin, America's second leading demolition company. His health premiums have almost doubled in 5 years to more than $9,500 a year. With this health reform,
I'm skeptical. I don't think we have enough answers.
Both Schwartz and his wife Teresa expect their premiums to keep jumping.
I mean, someone's going to pay for it, for the uninsured to be insured. And I just don't want it to be the middle class.
But how much we wreck all this?
David Griffin knows he'll pay more. His family built this demolition company. But his higher income faces higher taxes.
We've been successful, but we don't feel we should be penalized the more successful we are. It's not the American way.
This company's in the business of change, of tearing down and starting over. But no one here is sure this health care reform is change for the better. Mark Strassman, CBS News, Greensboro, North Carolina.